Emotional Intelligence, 2 manuscripts. How to Analyze People in Cognitive Behavioral Therapy, a complete guide to improve your relationships. Written by Lawrence Franz. Narrated by Jason R. Gray and Ridge Cresswell.
Using CBT to Battle Anxiety, Depression, and Intrusive Thoughts. Written by Lawrence Franz. Narrated by Jason R. Gray. Introduction. Congratulations on downloading Cognitive Behavioral Therapy, using CBT to battle anxiety, depression, and intrusive thoughts, and thank you for doing so. The following chapters will discuss how to start cognitive behavioral therapy, the disorders it can treat, cognitive distortions, cognitive behavioral therapy techniques, and activities for cognitive behavioral therapy. This book will detail ways to challenge negative thoughts, practice mindfulness, and reframe negative thoughts. What is cognitive behavioral therapy? Cognitive behavioral therapy, also known as CBT, is a type of psychotherapy that provides structure and techniques to release the emotional bond between negative thoughts and those thoughts' impact on the patient's mental patterns. CBT is a technique to release the negative internalization of these patterns. While negative events happen throughout our lifetime, many of these patterns are set during childhood. It is not just that all people have these patterns, but people associate meanings with them. Those patterns are a negative dialogue in a person's mind. These associations are called automatic thoughts. Automatic thoughts are responses that arise immediately when an event occurs, and may not be based in objective reality, but rather the subjective reality that a person experiences. These subjective realities are unique to each person, but are similar enough that schemas can be used to identify them and the cognitive distortions that a person might have. CBT can treat a wide spectrum of disorders, such as anxiety, depression, and intrusive thoughts, as well as more everyday therapies such as relationship problems or sleep issues. CBT is a very structured form of therapy that is often customized specifically for the patient by the therapist. It is also goal-oriented as opposed to talk therapy, which is more open-ended in nature. History of CBT. To understand the history of CBT, one must understand some of the history of behavioral therapy, or BT. Behavioral therapy began in the 1950s. Behavioral therapy is based on the work by John B. Watson.
Sample complete. Ready to continue?